describe this then. So on the left side there in the black and white, if you can kind of see in that, again, that southwest parcel, so it's the bottom on the left, just that first line there, that is our property there. And then I just added this second map here with the color because I just felt like it was just maybe a little bit easier to see. Again, on the left there on phase 1, so in that, I'm seeing it as orange, I think that you probably will too. Just that first line there on the left side, that will be our property for the mental health hospital. So again, we take this before the County Commission for approval to finalize that land donation agreement from the Lang Community Foundation. And then we will close on this property on or before August 31st of 2024. And this is just another map. Basil may have this in his slide deck as well, but this is just a site plan of seeing what that mental health hospital will look like on that property. And you can see that there, hopefully you can see that on the bottom there will be 3 entrances into the mental health hospital. 2 being a patient drop-off. So on the left side, that is the forensic drop-off entry point. The middle then will be the employee and visitor access point. And then on the right side then will be the acute patient drop-off area. So then for design and construction timeline, for right now what we have completed with Pulse Design Group and Tesserae, who is again our architect and engineering team, they have completed design development as of July 26. So our timeline for construction documents, and that's what we would put out for bid, that would be completed mid-October. So we would go out to bid for that, soliciting a contractor on October 24th of this year. And bids would be due back to Sedgwick County Purchasing November 22nd of 2024. Then we would present a bid contractor selection to the Sedgwick County Bid Board and then to the County Commission on December 11th. And then contract would be signed by both Sedgwick County and the contractor on December 19th of this year. Construction then to begin February 2025 and then would be complete late August 2026, so 18 months for that construction timeline. So that's my update, and I'll go ahead and hand it off to Scott.
Thanks, Tanya. And thanks for being here tonight, and thanks again to Campus High School for hosting us. My name's Scott Bruner. I'm the Deputy Secretary with the Kansas Department for Aging and Disability Services. I work with all 4 of our existing state hospitals at Larned, Osawatomie, Parsons, and in Topeka, and I'm the project lead for this project. I'm going to repeat a little bit of what Tanya was saying, but what I wanted to add was the kind of perspective on what we're trying to accomplish with this building and the types of patients that we're going to serve. So our goal here is to build an acute psychiatric hospital to serve adults that are in mental health crisis. It's not, this isn't a walk-up facility. It's not like another hospital. To be a patient in this facility, you've got to meet some statutory criteria that are already established that are the same as for admissions to Larned or Osawatomie. And so we want to keep those things intact. This is really adding capacity to our system to serve adults who are really in the most severe need to have their mental illness treated and that need treatment that is sometimes against their will. So they're involuntarily committed or they're in custody and get treatment at our facilities. It's a secure facility, as we've said, and the plan with the funding that we received from the legislature this year is to build the full 104-bed design so we can serve that total number. Again, the patient profile, to be admitted, you have to be an adult in mental health crisis and be ordered by a court to receive care and treatment. And some patients will be ordered by a court to our hospital to have their competency to stand trial evaluated or undergo treatment to have their competency restored. So the 2 types of patients that we see are those that are in a crisis, may arrive at a community hospital in the emergency department. They're in psychiatric crisis and they need more help than They don't have a physical illness, but their mental illness is severe enough that they need some stabilization. And based on screening that happens by the Community Mental Health Center, and then the court deciding that that person needs treatment, they're involuntarily committed to one of our facilities and transported and receive that treatment. We stabilize them as quickly as possible and get them back to their community so they can continue receiving treatment from the Community Mental Health Center or other community providers. The other kind of patient profile that we have are those that are in law enforcement custody that have committed a crime, but their competency to stand trial, whether they will understand the criminal court process, is in question. And so the first step of that is to evaluate whether they're competent to stand trial. If they're not, then that defendant is ordered to the state security hospital to have their competency restored. And in that process, we address their mental health needs. We also teach them about the legal process so they can understand what's happening. And if we're successful, then as they're restored to competency, they're able to go back to jail and continue the criminal process and then on to prison or whatever the next step is. But those are the two types of patients. In our facility that we're working on here with Sedgwick County, 52 of the beds, so half the building, will be those acute inpatient patients in mental health crisis. And at 52 beds, given our current average length of stay and the amount of treatment that we provide, we think that'll serve about a total of 1,000 people over the course of a year. With the other 52 beds for competency evaluation, again with the same kind of length of stay and treatment, we think that'll serve about 200 people a year. It comes up, and we try to talk about why Sedgwick County is our choice to have this facility here. This is the first new state hospital that we've built, actually the newest building we've built in over 30 years. Our philosophy as a state is to meet people's mental health needs as close as we can to where they live, where they work, where they have community supports. And so with our two options for state hospitals being Larned and Osawatomie, that's convenient if you live in Miami County or Pawnee County or in the western part of the state. But for a person here in Sedgwick County, we're going to transport you 2.5 hours to Osawatomie for treatment. Keeping those connections with local resources is difficult. So it makes a lot of sense to build another facility that's closer to where there's a good population center. A good number of the involuntary admissions that go to Osawatomie are from Sedgwick County, so there's a need and a demand here. There are other community providers, ComCare, Ascension Via Christi, St. Joe, do excellent work to deliver services. The role that we play as a state hospital is a little different, and as a statutory definition around what the needs are. And again, that need doesn't go unmet, but it does require that distance of travel from Sedgwick County. In terms of the competency treatment, a good chunk of the folks that are waiting for treatment at Larned for competency are from Sedgwick County. They wait a long time, well over a year. And so having more beds here in Sedgwick County, just more beds in our system, will shorten the wait time and reduce that delay. The last, maybe next to last reason is the hospitals that we have now in Larned and Osawatomie are in fairly rural communities. It's hard to find staff to work in those buildings, so we thought if we're building a new facility and want to meet the same level of need, building in a population center where there's just more people, and also the kind of training and educational infrastructure that's in place and that's being built in Sedgwick County really makes sense for the location. The final reason I didn't put on this slide, and haven't in 9 months, I don't know why, is we've got an excellent partner with Sedgwick County. Legislators from the area, members of the county commission, have really advocated for this facility to meet the community need and want it to be in Sedgwick County. And that very cooperative partner has been a really important part of this project moving forward at the pace that it has, and it's a very important part of our approach. This is about project funding, which Tanya already went all the way through. There's some COVID relief money that's going into this project that's directed to Sedgwick County. There's other money appropriated to KDADS that we're working with Sedgwick County to construct the building. And then the final step will be as construction is completed, the ownership of the building will be transferred to us, and we'll operate it as a state hospital as we admit patients. Tanya talked about the timeline. Again, our target date for the first patient that we would admit is in January of 2027. Lots to do. We've done a lot up to now, but lots left to do to get to that point. But that January date is very, very doable, meets some of the other funding timelines that we have as well. And it's down the road, but this is a significant project, and we want to make sure we get it right. But January 2027 is when we're looking to have the building fully staffed and ready to accept patients. I did want to also call out, in addition to the efforts that we've tried to do with community outreach and talking to folks in town halls like this, we asked the governor to issue an executive order to appoint a 14-member advisory panel for this project. The panel's charged with gathering public input on the needs and location of this regional hospital, where it fits with the existing services in Sedgwick County and resources, and where there are gaps. That panel's been meeting for almost a year now, monthly, to talk about various issues related to the project, get project updates throughout. We've had a couple of focused conversations about the interactions with law enforcement and how that might work, and then also workforce development, and what this hospital will need, what other service providers in the community need in terms of meeting workforce needs, and how we can really fit all those needs together and advocate together for additional resources to train more social workers, psychologists, psychiatrists, direct care workers, and other professional staff that we'll need for this hospital and other service providers need as well. Kind of the last issue, there are some statutory changes that we'll need to make to accommodate this building, and the panel's been discussing that. We meet every month. There's 14 members, like I said, including myself and people from Sedgwick County government, law enforcement, some legislative members, and the mental health treatment community. It's been a really great sounding board group for us from KDADS to talk about issues, to kind of make sure we're tuned into what the community needs are. And I think it really has helped align a lot of the resource discussions that we've had along the way. That panel is working on its final report that's due at the end of September. We're going to keep meeting through I think our charge goes through March of next year, so we'll have some keep having meetings even though our report will be done, but there are some timelines for recommendations that we need to make to have in the legislative process, so that'll be here in the next month or so. And then just a couple of the websites, again, the QR code will get you to the several of these places, but where we've been posting information about the town hall meeting transcripts and recordings, other information that you've seen about the project, and we'll post the materials from tonight there as well. So when we show you the renderings, or when Basil walks through those, if you want to spend a little more time with them or go into them in more detail, you'll find them on these websites. But that's my part of the presentation. I'm going to turn it over to Basil with Pulse Design to walk you through some renderings of the building. This is really exciting. I haven't been involved in a building project like this, but to go from talking about what we would need in a facility like this to meet the needs of patients, to meet the safety needs for our staff, has just been it's been a very intense process because we're working on a very short timeline, but to see that kind of get realized from an idea or concept into lines on a page that indicate where patient rooms are going to be, and to now see them in 3 dimensions is really exciting. It's energized our team, both my folks and folks that work at Larned and Osawatomie, to see what's possible and really make this huge leap in our system. So excited to let you all see what the design process is resulting in. So I'll turn it over to Basil.
Thanks, Scott. So my name is Basil Sherman. I'm a principal and owner with Pulse Design Group. We are an architecture firm that exclusively does healthcare design based out of Kansas City, but also grew up here. I'm a Colt, played trumpet right over there a couple times in my career. So I'm certified by the American College of Healthcare Architects for architectural design. Also, I'm certified for evidence-based design by the Center for Health Design, and have spent 20 years of my life doing nothing but healthcare design. So this is my passion. It's what we do, and I'm excited to show it to you guys. As we go through this, one thing I want to talk about is what our original mandate from the state and the county was, which was to design a hospital that helps destigmatize what it means to be in a behavioral health setting. I think we all have to remember that these are people that have an illness. Just because they don't have a cold or a flu doesn't mean they don't need treatment, doesn't mean they don't deserve to be treated like humans. And how do we destigmatize that? How do we create a facility that actually enables their healing, not actually disables their healing? So with that said, we'll walk you through what we have here. So we're going to go over the overall site plan, some exterior renderings, overall floor plan, entry and waiting rooms, the overall patient wings, day rooms, which that's kind of a therapeutic space on the patient spaces, patient corridors, and patient rooms, and kind of hopefully give you a sense of what we're trying to get done here. So, Tanya already alluded to the site, so we won't spend a lot of time here, but bottom left-hand corner of the One Rise campus is where we're sitting at. So this is a site plan. One of the things I also should have emphasized on our mandate, it was, in addition to destigmatizing it to it, safety had to be a core focus, both safety for the patients inside this facility, the staff that operate it, and anybody and anyone around that facility. So it may be difficult to see on here, but we actually have 2 layers of security fencing around the facility, both from a street front, but also from a enclosing the building standpoint. I don't know if this works. You couldn't get a good view of the picture. Let's see. Yeah. So there's actually a fence that runs around the entire property line, and then actually a secondary fence that is behavioral health grade and certified around the inside of the actual building itself. But on top of that, we also want to make sure that families of these patients have the ability to visit them and not feel like they were coming to a prison. They're not. They're coming to a hospital. So the actual public front door is open, and you can come into this drop-off area, which we'll see in a moment, and then enter the facility as if you're entering any other hospital. You are there to visit a patient, to see a loved one. So with that, this is a view of a kind of a bird's eye view of the facility. So if you kind of reference back and actually let me back up one. So, basically each one of these fingers represents a patient care wing, which you'll see in a minute. So when you go to this view, these over here are kind of what you see from the patient room. And this up here is the main front door. Kind of zoom in here. This is what you see as you approach it. Again, wanted to try to make sure this isn't what this is a hospital. We want you to see that. You want to see calming. You want to see ingratiated in the community. This isn't a tall, imposing building. It's a welcoming building. It's a building that should promote healing, promote a sense of it belongs in the community. And this is just a step back a little bit coming up if you were driving up on the facility and ultimately being able to see, the gestures that we're trying to create with, movement in the building, colors, natural wood tones, more kind of those red sort of. This is actually a 50-year terracotta material, but ultimately designed to kind of mimic that feeling of brick, just like the facility that we're standing in. So a little more up on the actual physical floor plan. So as we kind of alluded to, here in the middle is the actual public entrance, which you'll see in a moment. And then as you kind of come through here, patient support spaces for medical treatment, because some of these patients may need an x-ray, may need a dental exam, may need an eye exam. There's a space in here for that. And then each one of these hands, or fingers as we call them, represent a patient treatment wing. In total, there's kind of draw a line down the middle. You'll see a gymnasium. You'll see interior courtyards. That's another thing. These patients need outdoor therapy, but we made sure that these are fully enclosed so they can seek that and they don't have to leave the footprint of the building to receive that therapy. Patients that actually arrive and admit come in through secure sally ports here and here. And one thing I will emphasize here, when you look at this, you don't see them. Again, we don't want this to feel like you're coming to some place like some imposing facility. But within the facade of the building here and here, you see the sally ports, and patients will be admitted here, come through an intake process and find their way to their unit. But they have a gymnasium space for physical activity, courtyards for outdoor activities, and then they have central core spaces that are supporting the patient units. Again, this talking about safety, the color coding you want to see on here is actually purposeful. If you have a space that's green, that's a place that a staff member can go and can be off stage, be able to relax, do their work, and not be on stage all the time. So these are very important spaces, and you'll see more about this, but each one of these zones here are what we refer to as day rooms. Upstairs, we actually have space separate from all the rest of the hospital staff and a occupancy area for the administrative staff, for anybody that's providing material supply, pharmacy, again, giving them a space that's up, little windows, daylight, so they have a good place to come work and be proud of where they work at. So this is a look at the lobby. So when you first walk in, this is what you'll see. Security and registration and whatnot happen here, or not registration, but receiving happen here. A small cafe and kind of coffee space over here for people to receive drinks, but ultimately be cleared and before sending back to visitation spaces. Again, high ceilings, trying to make this seem like a hospital. This is a welcoming place, a place people want to be at. Kind of zooming in on a patient unit a little more closely, you can see the central nurse station for staff. Very key part of this design is the ability for staff to see down every single line of the fingers here, so they keep constant eyes on the whole unit while staying safe behind their nurse station. They will be obviously out in the unit, but ultimately if they need to be in here, they can be in here and be safe and see what they need to see. Again, dining area on the unit, therapy spaces on the unit. The key is that a patient doesn't have to leave here to receive treatment. We're not walking them throughout the facility. They can be treated and go throughout their daily activities within the footprint of the unit. The only thing they have to leave for would be outdoor therapy or the gymnasium. Other side of this is similar, and the ring, even though there is a forensic side and an acute side Scott alluded to, they're being designed identically. They're being designed outside of a few extra safety measures to be able to provide the same hospital and therapeutic environment regardless of what your actual admin status is. So this is a look at one of the actual day room spaces. So this is the space where they'll be undergoing activity therapies, being treated. And again, you can see that central nurse station with clear line of sight, but behind safe glass. And then actually some high daylight and high windows to bring daylight in and get enough volume that, again, it's not enclosing, it's not debilitating, it's hopefully uplifting and something that brings people some ability to actually heal and feel some connection with nature through graphics. And another thing to emphasize, this is all built to behavioral health standard and quality. So that in the last decade, there's been a huge forefront in what we can do to keep a durable facility that can be built and maintained and safely treat patients, but still look and feel like a hospital. And that's what we're doing. This is one of the other units. Again, you can see some of the different colors and spaces and shapes. This is a look down the unit. So if a patient wants to be by themselves, they have these little nooks down the hallway where they can sit and kind of decompress. But also it's safe because the nurses will still be able to see them. It's not quite deep enough for them to hide in. So you'll see windows where nurses can see into the rooms and see the patients while they're in there and do well checks on them. But ultimately you can see that clean line of sight all the way down, tall enough ceilings that we can provide color and texture and nature. This is one of the other units, the blue unit. And then patient rooms, so you'll see we have an integrated patient bed, desk, window, and get access to daylight. The view from the nurse, you can see the nurse can literally see the patient right there, direct line of sight. In the forensic side, just to ensure patients are visible, we have the toilet areas open, but rather than giving like what you might see in some facilities where it's basically a toilet in a room, it's still a defined separate space that they can have some semblance of privacy while they're in there. Thank you.
All right, good evening, everyone. My name is Matthew Tannehill, and I'm here to represent One Rise and share about the vision of our health campus. So thank you all again for being here for this important town hall meeting. Our vision for One Rise Health Campus goes beyond just providing essential mental health services. We aim to create a world-class model that not only addresses the immediate needs of our local community, but also sets a new standard of behavioral health care across the region and state. Our commitment to this vision is rooted in intentionality. We have carefully designed an environment that caters to the unique needs of our community, particularly focusing on the underserved South and Southwest areas of Wichita. By bringing in resources and providers that have been lacking, we aim to uplift these neighborhoods, ensuring that everyone has access to the quality of care they deserve. Innovation is another cornerstone of our approach. Our trauma-informed environment is designed to provide a sanctuary to those in need. By integrating the beauty of nature with our facilities, we create a therapeutic atmosphere that promotes healing and well-being. Our campus will feature open, green spaces and calming environments that are essential for mental health recovery. Additionally, safety and security are at the forefront of planning. We understand the importance of creating a secure environment for patients, staff, and the community, and this campus will incorporate those measures to ensure safe spaces for healing and recovery. The One Rise Health Campus will also include a range of vital services. We plan to have services such as a federally qualified health clinic, childcare, and medical office access all on the campus. These services will provide comprehensive support, ensuring that both residents on campus and the broader community have access to essential health care and support services. Additionally, we are dedicated to creating an environment that promotes healing. These parks will be designed to offer serene, natural spaces where individuals can find solace and rejuvenation. We believe that integration of nature into our campus is crucial for fostering a holistic healing environment and creating a space that the community would be proud of. The services will cater to both residents on campus and the broader community, whether it's inpatient care, outpatient services, or community outreach programs. We are committed to providing comprehensive support that meets the diverse needs of our community. Our goal is to create a seamless continuum of care that ensures each individual receives the help they need when they need it. We are desiring to build a system of improved efficiency where collaboration between providers ensures that patients and the community receive the best care possible. By working together, we can eliminate gaps in services and streamline processes to deliver more effective and timely interventions. In closing here, I just want to express my gratitude to the support from our community, KDADS, Sedgwick County, the City of Wichita, and the State of Kansas. Together, we are building a brighter future for mental health care in our region. And the One Rise Health Campus, again, is more than just a campus. It is a beacon of hope and a testament to what we can achieve when we come together with the shared vision. I just thank you all for your time and for allowing One Rise the space to share.
Thanks, Matthew. And thanks to everybody who presented this evening. So we've received some questions from out there, and please know there's Don right there, and Ryan's around here somewhere. He'll pick up questions from you. And just a quick reminder that we're going to take all questions tonight in writing, but if you're not comfortable with that and you want to go and tell one of our folks that, they'll write it down for you and bring it. And just another quick reminder, at the end of the evening, you'll have the chance to ask your questions on a survey that'll be available online and then on paper. So this is the acrobatic part of the evening. In order to make sure everybody's questions are heard, this is where I get my trifocals lined up and I read your handwriting. So this is where you're kind and gracious, right? Because we really do want to hear from all of you. You don't have to ask questions, you can make comments too. So please feel free. So I'm gonna read these questions off, and these 5 people will decide who's the best to answer that. The first question is, could you please restate, and I think this is probably Tanya, help us envision again what part of the corner of MacArthur and Meridian we're talking about. So now that it's become reality, you're sitting there and you're like, is it across from the Quick Trip? Where are we talking? Could you help describe that?
Sure. It is the southwest corner of MacArthur and Meridian. So yeah, Basil, can you go back? And I would go back to one of my very first slides.
Also, folks, at the end of tonight, if you want to come up and take pictures with your phone to get closer to any of those slides
One
and
more.
maps, anything, please
more.
feel free.
I
We'll
would
do
go
it.
one more. Keep going. Okay. This right here is the Quick Trip. So I'm calling this the southwest corner, MacArthur. Yep,
Southwest
southwest
corner.
corner, MacArthur Meridian.
Thank you. It's becoming more of a reality. I don't know who did it, but it was Tanya did it. Tanya did it. All right. Thanks for everybody's patience as I mentioned, the acrobatic part of our evening.
So,
Okay.
Monica, before
Yeah.
we go on, so I think what the whole parcel, the One Rise parcel, is the northwest corner of MacArthur and Meridian. The hospital, the portion of that campus that's where this hospital is the northwest corner of that parcel, if that helps.
Okay, say those directions again so everybody can get it in their mind.
So the One Rise campus is the northwest corner of MacArthur and Meridian. And our site is the furthest west on that and south on that property.
Thanks for repeating that. Appreciate that. The next question we have is, will this facility have a board to keep the hospital on a standard for mental health care? That's probably a Scott question.
This will be a state-run hospital, and by federal regulation, there has to be a governing body. And the way we operationalize that at Larned and Osawatomie is that the Secretary of KDADS, who has the legal authority over state hospitals, is the governing body. So, and she delegates that to me. So we meet quarterly with I meet quarterly with the hospital leadership and get reports about risk management, staffing, quality issues that are part of the accreditation and certification process. So that would be our approach for governance. Is under the statute, the secretary has the legal authority over the hospitals, and then we operationalize that through a governing body structure. So there won't be a public board. There will be, it's a state-run facility.
Basil?
One other thing I wanted to note
So,
there
yeah.
is that when we design hospitals, there are federal regulations that are designed by clinicians and caregivers nationwide called the FGI Guidelines for Healthcare Design and Construction that we have to follow in order for their facility to be able to be licensed and certified by the government, but also by what's called Joint Commission. Jeez, I need
So
to
if there's, if there's anybody here that can help us with that, we would love you
But
forever.
ultimately, so all of those codes were used in the design of the facility you see, working with Scott and his team to make sure that the facility will enable that same care that he alluded to.
Thank you for that clarification. The next question is about community. How are the concerns of the neighborhood folks, I'm just going to ad lib there, neighborhood folks, which were brought up at other meetings, being addressed? So we've had several town halls, we've had stakeholder input surveys, we've had opportunities for people to share their concerns. Is that an accurate statement? Yeah.
That's true. The other part in the zoning change to get, because we had to change the property lines a bit to accommodate the size of the building in that zoning process through the city of Wichita, there was a challenge, and Tanya can talk more about this, but and one of the modifications the city council made to for the zoning approval is that we're building a masonry wall along the west edge of the property to where the neighboring property is. So I think a lot of the concerns were about kind of the sight lines and safety, and we've been trying to incorporate that. Again, we want the community to be safe too. We want people who are committed to our care to stay inside the building and control that. So we've been building in. We talk about safety all the time. We talk about perimeter security, layers of security to make sure that that once you're inside the building, you don't get out unless you're authorized to. But then also with the design and kind of the site plan, trying to make it, again, soften that look, not just have a fence and a wall. It's with planting, and again, so it still has the therapeutic nature and fits with the community. Again, there's nothing else around us at the moment on the property, but again, maybe we're setting a theme for that for the remainder of the development of the One Rise campus.
And we'll restate that your opportunity, we have multiple opportunities to share your concerns, and those are being collected and shared on a regular basis.
And I think I would add too, anytime someone's coming to me with a concern, we did have a couple of subcommittees that were talking about safety and talking about workforce. I asked anybody who reached out to me if they wanted to be a part of that. Some of them were, some of them weren't. So we try and include as many people as we can in these designs and discussions to help alleviate some of those concerns, but also so you guys have input on what that's going to end up being anyway. So safety's been forefront the whole time. We have the sheriff who's taking a look at this and has been really integral in design and everything to make sure that he feels that it's a safe for him as well. So I do feel like we are addressing those. If you have concerns that you feel we haven't addressed, talk to me after. I'll give you my cell phone number. We can set a time to meet, or we can have a phone call, or whatever works. But I'm happy to do whatever I can to help alleviate some of those concerns and give you the reality and the facts that we have, and not maybe the concerns that might be building up in anybody's mind.
Thanks. Appreciate that well-rounded answer there. This one, Scott's probably for you because it feels a little bit like programming. Will visitation be allowed in these units? So will there be visitors coming and going from this
Sure.
facility?
There will be. We promote, ask, we want families involved in people's treatment and therapy. We won't allow visitors to go onto the unit, and we can, when we get done, if you want to see that, we can put it on the floor plan. But there are secured areas where, so visitors will come in the front entrance, be checked in, that we know they're there. Our current process, and I don't know why we would change it for this building, is we have their scheduled visits, so we know somebody's coming, and that way the staff can be prepared to get the patient ready to go. And then people are, the guests are screened for through a metal detector for tomography. And then we've got both kind of a group visitation room where you're just at a table with your loved one, and then some, because of the criminal background or the criminal charges that a patient might have, it's more of a there's a glass between the patient and their family members, but they can still share information and talk to each other. Again, we want to prevent contraband being brought into the building and passed to a patient, those kinds of things. But we certainly want to promote visitors coming in a scheduled way and have an opportunity to meet with their loved ones.
Thanks.
Certainly in person, but we also do virtual. I mean, COVID, during that, when we couldn't allow guests in or visitors in, we did a lot virtually, and that's a very effective model, particularly given at Larned and Osawatomie, most people have to drive in, or it's somewhat of a distance to travel. So that'd be another way to make visitation happen.
This is one that we've heard a lot throughout this whole process, and it's issues of workforce and concern and recognition that workforce, everybody is struggling with that. This question is, will there be enough workforce, enough people to do the jobs?
We talk about that a lot in the conversations, because Joan Tammany from ComCare is on our panel, and I think maybe the first or second time we talked about the size of the building and going from 50 beds to 100, and just the multiplier that does to the staff needs. And when we shared a number of somewhere between 250 and 300 people would be the staff complement based on our how we operate at Larned and Osawatomie. And that's a real scary number when ComCare's looking for, I don't know how many professional staff they're looking for, but it's probably close to that same number. So part of the development of this project is also to work with Wichita State, with the University of Kansas, with the Osteopath School, other independent colleges and community colleges to really think about developing the workforce pipeline. So we're training people that want to work in behavioral health. Maybe they don't know they want to work in behavioral health, but see that as an option, what the choices are. There's lots of different ways you can serve people that in mental health needs, as a social worker, as a registered nurse, as an LPN, as a psychiatrist or psychologist, or anyway, lots of ways. But we need to open up those pathways, and some of the additional money the legislatures approved this session are designed to promote more psychiatric residencies, promote nursing faculty, so that there are more nurses training nurses, because that's another part of the pipeline that needs some support. So I think we're trying to address that. There's a lot of that money is flowing into the system for this school year. So in the 2 years or 3 years it takes us to construct, hopefully there'll be a new batch of some of those professionals that we can access. But recognizing we've got to share with other providers as well and make sure we're kind of growing the whole pie as opposed to dividing it up into smaller pieces.
And the advisory panel had a work group on workforce, and their recommendations are available online in the minutes, and I would say cover a large gamut of everything under the sun, from incentivizing to better pay to quality of life. all
Well,
those
and I
things.
think also, here pretty soon, we're going to have 3,000 medical students downtown with a new biomedical campus. That obviously won't have produced people yet when this opens, but it's a really great option to have that pipeline being built for long-term sustainability of this. And so we are looking at the near future, but we're also looking at further into the future as well with that opportunity.
This question is very specific, and I bet it's yours, Basil. How tall are the fences around the buildings? Yep.
So the interior anti-climb fence is 10 foot with an anti-climb resistance item above it. Yeah, slanted, sorry. Luke works with me, so does Fred over there, sorry. And then
Photo
the,
friend.
yeah, exactly. And then the inner perimeter fence is, I believe, 8 feet. So even if they got through the fence that's not designed to be climbed, there's an additional 8 feet fence past that.
While you're here,
Yeah.
let's talk about the windows.
Okay.
So if a patient is looking out the windows, will they see into neighbors' yards, or how's that designed?
No, they won't. So if you look back at the, well, first and foremost, the windows have what's called an integral blind in them. So there's actually view control through those that they don't specifically have access to. A carer or staff member would have to kind of alert that. But we're also talking about different mitigation measures. But we want them to have view. We want them to have daylight. But if you're looking at the landscape plan, the windows all face into these little kind of courtyard, in between courtyards. So what they're viewing is plantings and trees that are kind of giving them a view of nature without giving them a view out into the community, if that makes sense.
It does. Thank you for that. This, I think, is probably Scott. The Detox Rehab Center, is this going to have people coming and going freely? So the Detox Center is not part of the state hospital plan?
No. So what you saw on the One Rise plan, the vision for a detox and sober unit is separate from the state hospital. What we've talked when we did community needs assessment with the community of Southwest Wichita, there's a need of inpatient and outpatient beds. Again, this is something that's far in the future where no operator has been identified, but it's something that we know is needed within our community here in Southwest Wichita. So as that continues to develop, please talk to me after this and I'll make sure you have my information to dive in deeper.
Hey, thanks for mentioning that. One thing that I want to make sure everybody knows, and I don't forget to say, is when you fill out the survey at the end, we're asking if you would like to continue to receive updates via email, if you'll give us your email address, and then we can also share those email addresses with One Rise as that progress happens. The next question, how will you staff the hospital? There's such a huge shortage, so we've talked a bit about that. And that's going to be an ongoing process, right? And one of the other things that's written on this card, as I said, comments are welcome too. This facility is needed in the Wichita area. What a blessing. The next question is about funding. Is the funding for One Rise included in the $107 million already pledged from the state?
That money is specifically delivered for the county to do the hospital, so it is not associated with One Rise, the 501c3.
And so just stay right there. Anybody ever have to do that? Your trifocals don't do the trick, so you do this number. Who is financing One Rise? Is it private or public?
So One Rise comes from the philanthropic focus of the Lang Company and Lang family. They have been the originators of this plan. As we continue evolving the organization, we are a public charity, so philanthropic donation is a part of that. But as we continue looking at building the organization and campus, that could look into grant funding to other economic developments from the private sector that can help in creating the services on the campus, especially as we identify the service providers that can land on the campus specifically.
And I'm going to assume this question is about One Rise also, and if I am misrepresenting your question, if you want to clear me up with another card, I'm happy to do so. But did you mention inpatient services in the part of the One Rise plan?
Correct. Again, when we did the community needs assessment and understanding the continuum of care, items that were identified were specifically around substance misuse. What would it look like to have inpatient treatment as well as outpatient?
Okay. And then community services, could you talk a little more about that?
Yeah. So the other piece that you'll see on our campus is what's called a community care center. This would service as a central hub for a multitude of social services to be accessible not just to those that may be on campus, but as well as the surrounding community. This can look like anything from more case management services, workforce development, and other outpatient-based services that meets the holistic needs of an individual that may come to the campus.
You're doing so good, Matthew. We're going to keep going. Will this group be seeking licensure as a community mental health center or community mental health clinic?
Are you referring, I guess.
Could you clarify what kind of services will require a license in your plans?
So that'll be based upon the operators that we find that come on the campus. Federally qualified health clinics may have their own licensures for the services that they provide, just like the psychiatric hospital have their license to do their work. So each opportunity that comes to One Rise, we would work with those providers and those experts to identify the proper license needed to do their operations.
Thank you. So we'll give you a break. Other mental health facilities are concerned and experiencing concerns about staffing. Is there a plan for recruiting without basically just moving people from one facility to another, which will only make the problem worse? So I guess maybe part of that question is there collaboration of multiple behavioral health providers in this current process?
Well, that kind of set the question up for an answer that's yes, but
Yes.
so we are trying to, so with ComCare, with other service providers in Sedgwick County, we certainly want to hear from them. It is, like I said, we have to grow the whole pie of provider types. So psychiatrists are hard to find. So developing the psychiatric residency program at KU Wichita is a big part of that, of creating the pipeline. It creates the pipeline of students that eventually become psychiatrists, but also supports the faculty that can then train those student physicians, but then also others that might not want to be an MD, but want to get a PhD in psychiatry or psychology, and those are all needed. I think where it kind of tiers or gets, certainly gets complicated, is that like ComCare doesn't require the same kind of licensure or staff that we'll need at the state hospital. There are some overlaps. Social workers are generally social workers, psychiatrists are psychiatrists, but I think there'll be some tiers. So as what I'm excited about as the opportunity is if you present the possibility of working in behavioral health to a high school student, you could say, well, you know, if what you really want to do is work around kids that are struggling with substance abuse, well, there's a job path for that. Here's what that job would look like. Here's what the pay ranges are. Here's what the educational need or requirements are. And then what's the next thing if you want to go from that and move on to some other professional licensure or continue your education. So the more we kind of, that structure is already in place, but the more we can talk about with students, I'm almost more worried about overloading them with choices and say, well, I don't know what I really want to do or where I want to fit. But then it's kind of, well, there's all kinds of opportunities to you know, work in a facility like ours as a direct care worker, and you can see what that's like on a daily basis to support somebody who's in mental health crisis, or work in comp care and support a child that's in crisis or just needs some day support. So a lot of opportunities. A lot of it, again, like Basil said, and Matt as well, it's reducing stigma. It's about this. It is. There's no risk, but this is a very fulfilling thing to do to try to help people that are really in crisis and work through their issues with them. Some of that's about finding the right medications, but some of it's being a good listener and helping people learn new skills and adapt. So I think there's a lot of opportunities. It's a really terrible answer to your question. I apologize. But I do think it's a lot about creating opportunities, and we've all talked about we got to start much earlier than we do today because some of those choices are already made. And the other, talking with WSU Tech in particular, I mean, their specialization is finding industries and matching job training to the particular industry. And that, although that doesn't feel like something that healthcare would normally do, it really fits our model because it's about if you want to have workers come in the door and be direct care workers, what do they need to know, how much are they going to make, and what's the next thing that they can do? And if we can answer those three questions, then it does kind of close some of those gaps and you could see a path. Having facilities like this also, then that's a place where I can work and I know what that, or have some idea of what that means. So again, I think it's reducing stigma, reducing the mystery of it, creating new opportunities, and then honestly, so other than that, kind of connecting people from job to wage to training, it's also providing opportunities to be exposed to these environments and get paid. So lots of students have to do internships. A lot of times they do that for free, but in many other industries, including healthcare, paid internships are a way to keep people connected to a job, connected to a service provider, and have ongoing relationships. And that has worked a lot on our campuses now, where if we pay social work interns, psychology interns to come back and be therapists, they get, I don't know it's the money necessarily, but the money reduces other barriers. So I think all those things, we know some things that work. We're going to do those things and hopefully learn other things that work along the way.
I would also add USD 259 has like a Future Ready Center for healthcare. And so mental health is something that they're going to be addressing with that as well. So it's just another way to build that pipeline. The state has done a lot of work when it comes to our aerospace industry. And so we're trying to figure out how do we tap into some of that? How can we make it easier to become a healthcare professional, whether it's mental health or physical health? How can we make that path easier at the state level like they have in aerospace? So there's a lot of work happening along those lines too. So I do think that there's a lot of opportunities coming. I went to a union leadership conference not long ago, and they were talking a lot about apprenticeships, which I think are incredibly important because as you're training, you're getting paid that whole time and you're able to have that balance, especially if you have families at home already. So I would love to see, and I kind of mentioned this to them, and we'll have a follow-up discussion, but how can we introduce apprenticeships in the healthcare space? It's not something that's currently being done, at least not at the scale that we would love to see it. So those will be ongoing conversations too. So I think we're trying to hit this from every angle that we can possibly hit it at this point in time. But if you have any ideas on ways that we can find a different path, please let us know because we're open to any and all of those too. This is going to be a multifaceted approach, and we have to make sure that we're able to address what comes at us.
Yeah, the last thing, okay.
You're going to have to move again.
I'm trying not to move her. The last thing I want to say is I think it's also like supporting facilities like this. This is not the way behavioral health hospitals were designed 20 and 30 years ago. This is not, you know, people, you want your kids to be proud of your kids to be working in a facility like this, to talk it up, not talk it down. If we don't encourage people to go into these roles and act as it's a proud profession, they're not going to do it. And if we don't build facilities that are safe for them to do it in it, then they're not going to do it. So I think designing the facilities to be a place that you're proud to work in and have a retention and safety and knowing that, you know, I want to talk about why I work, not be like, well, this is what I got when I got out, so I guess this is where I work. I mean, it takes all of us to take this destigmatism away. You know, people have to know that it's still an illness and treating it as a proud profession.
One other note along the way, another large behavioral health employer in the region, Ascension Via Christi, has been heavily involved in these conversations, as have community coalitions that have multiple types of behavioral health providers engaged. So thanks for your answers on that. Let's get down to, this is the big winner of the evening. There are 6 on 1, and I can read all of them. Let's do it. How long do people normally stay at this facility?
So our acute treatment, average length of stay is around 14 days. And on the forensic side, it ranges probably between 90 and 120 days.
When do you think you're going to start taking applications for all of these new positions-ish?
That's a great question. We probably not until we're maybe closer to 6 months before we open and accept patients. We've started talking about that of if, I mean, we'll have a building, but it'll be under construction, so we'll have to have some place for people to work. We can relocate people to Osawatomie and Larned to train in our existing buildings. That feels really awkward to me, but so we are talking about what that timeline would look like, and I appreciate the question, because I think at future town halls, we ought to lay out some of those, the types of jobs, the types of training, and sort of what the timelines will be. But I would guess, 6 months before we open will be the kind of big push to fill positions so that we're ready to go on in January 2027.
Will there be a pharmacy there?
Yes.
And then is there a cafe or pleasant type environment for visitors? I think you addressed that a little bit in your discussions. And then I'm going to give Basil 3 in a row so he doesn't have to keep jumping up and down. But one is about the visitor cafe. The next one is about what happens in a tornado or fire situation to ensure somebody just doesn't walk out. And then if you can keep a third one in your head, where is the tornado shelter?
So great questions. Again, this being a hospital, in particular a mental health hospital, the disaster response plan for patients in any hospital, not just in a mental health hospital, particularly in a mental health hospital, is to protect in place. So all of the patient wings, as you see them, are hardened for a F5 tornado, 250 mile per hour tornado. So the intent is to protect the patients in place. The rooms, the windows, everything are designed to the scale to a 250 mile per hour safety mechanism. So, but in addition to that, the actual gymnasiums themselves are hardened. So the staff members from upstairs and the staff on the unit, once they've secured the units themselves and know that they're safe, have a place to go and be safe. But the intent and thought behind that relative to a tornado is that even if other parts of the facility that aren't what I just alluded to are damaged, those are standing, and the patients aren't out. The patients are safe, and they're not leaving the facility. Additionally, relative to a fire safety in healthcare facilities has to go into what's called smoke compartmenting. You laterally egress for safety. You don't, again, leave the building. So should, let's say, this unit have a fire, they egress laterally to another part of the building, into this one, or into the gymnasium. Like you move the patients away from the fire, contain the fire. The building has to be fully sprinkled for that. So again, there isn't really a scenario in hospitals where the intent is to abandon the building unless it's truly a catastrophic loss, which we do our level best to prevent, and in which case there was probably loss of life anyway. But yeah, fire and smoke, or fire and other safety mechanisms are lateral, and then the tornado is protect in place. And then I don't know if anybody's noticed it, but I alluded to the cafe area is kind of back there.
Thanks. Stay right here. Could you restate the details about the tops of the fences?
So the fences, I'll try to draw it with my laser here, are like this, up to 10 feet, and they have a part that kicks back, so the patient being on this side. So first of all, 10 foot, and actually I didn't speak to this earlier, the material is called anti-climb. It's actually not big enough anybody can get there. This isn't chain link. You can't get a hand grip on it. So it's designed to prevent climbing. It's designed to prevent scaling. But that kickback also applies that even if somebody was able to try to jump and have an amazing vertical to get a hold of the top of the fence, there's no way to kind of come up and over it. So it's been designed specifically for behavioral health settings and for security settings to that extent.
Thanks. Appreciate that.
I did just, so we've got, I think what we call it at the state is enhanced vending. So we aren't going to have a grill or make hot sandwiches for guests. We talked about that. We tried to figure out, is there enough space and how would we staff it? And we opted for, there'll be vending that's available that, like a corporate kitchen, what's the other one called? That, anyway, but so you can purchase items. Maybe there's microwaves available to reheat them, but there won't be a restaurant inside. We're not going to have a Starbucks. It'll be more of a vending kind of situation.
Right. Hey, Scott, while you've got the mic, is this a 24/7 type admission process? Will there be 24/7 admissions?
It's not, our model at Larned Noswabi today is 24-hour admissions. We typically don't, or it doesn't happen because law enforcement doesn't want to transport 24 hours a day, but we're staffed in a way that on the existing campuses where we could do an admission any time of the day.
Okay, thanks.
I don't think that would be our plan, but we
Okay.
certainly would be able to if we had an emergency that we needed to.
Thanks. While you've got the mic, I am sure every day of your life you work on staff retention in all of your facilities. So the fine folks that are already working for the state or working for these other types of facilities, what discussion has been about keeping them?
A big part of it is pay, and another, I don't know, 50-50. Another big part is work-life balance. So we've done a lot of work on pay over the last 3 years with the support of the governor and legislature. We've raised, so if you're a registered nurse, entry level, just out of school, your starting wage at Larned Noswabi is somewhere around $41 an hour, which we think is really competitive wage. So I think we're doing pretty well on the base wage. We've done some things around bonuses that we try to encourage people to retain as employees or recruit others. I think the other issue is work-life balance. So we're 24/7 facilities. If there's a staff vacancy, you can't leave the unit unattended, so people work a lot of overtime. And that's great for wages and what people can earn, but there's a maximum limit of what people can work, and there should be. So I think the work-life balance is a big part of that. Recruiting, getting enough employees is a big part. We supplement staff with contract nursing as well to kind of make up some of those gaps as well. But I think pay-wise, if we don't lose ground of where we are over the next couple of years, we'll be, I think, competitive with other healthcare providers in the same kind of space. Work-life balance may be a little bit more of a challenge, but we do talk about, try to be flexible as much as we can. We'll talk about the shift structure, whether it's 2 12s or 3 8s, and how that staggers. But again, it is trying to figure out what the right mix is. But 24/7 facilities are difficult. Anybody who's in healthcare, you know what the challenge is. But again, I think it starts with wages and being a meaningful place to work. This is going to be a beautiful building, and I think our goal is in the leadership is to not screw it up by making it a difficult place to work on top of, it looks nice, but it's got to be functional. So that's part of our challenge over the next couple of years too, to make sure we've got a good retention model.
Yeah, the other thing that we do a lot, and this is universally in healthcare, not especially post-COVID, a lot of people fled the industry, is having places where staff can go to just get away and be alone and decompress, or maybe with a colleague and talk and discuss about their issues. So there's a lot of facilities, the plans are too small to see it, but spaces in the building designed so that, for lack of a better way of putting it in paper health, the staff isn't always on. They don't always have to be looking over their shoulder. They have some place to sit down, do their nose down work, and know that they're safe, but also get away if they just need to decompress and sort of self-regulate, if you will. But also there's a rooftop garden on that upper level for them to go and get away for break and for just collegial gathering. So this facility has really been designed with staff retention as a core aspect of it. And another facility that we completed a few years ago, I won't mention names, saw a direct improvement to staff retention when they're remodeled. That particular facility was remodeled, was improved because staff were safe, it felt better, patients were actually less agitated because the space was calming them and not agitating them. So it's sort of the combination of sort of support from your employer and the facility not actually making your job harder.
Thanks, everyone. This question is, I think it's in relationship to Commissioner Lopez, what you brought up about UST 259 and the healthcare track. How long has that been going on? And if it's been going on for a while, are we seeing that help? Or when do you think it might? Three
Well,
questions.
They initially started the Future Ready Center for manufacturing, and they've seen incredible success there, where students are graduating from high school with different paths that are already hiring them. I mean, when I toured that facility, they were telling me about how they were trying to get students to come work for them, and they were like, you have to let them finish high school first. So it's a very similar model, but it's for healthcare. Obviously, you're not going to be able to take like your CNA license or any of those licenses until you're 18, so it won't be quite the same on that level. But it's a newer facility. This is the second one that they've started, so we haven't seen it progress into what I think it will get to. So I think there's a lot of work to do there, but they're definitely onto something. And with 259 and WSU Tech, they're doing an incredible job of being really forward-thinking and industry-driven. And this is an industry that they are hyper-focused on. And so I think we'll see a lot of changes going forward, more than even what we're seeing today.
And Kansas State Department of Education is doing some work too?
Right, we've talked to them. One of the healthcare pathway, they've just recently been revising the curriculum and the requirements for that. And I think they're going through another round of revision in the next year or so. And we reached out and submitted some comments saying we really think you ought to have in that healthcare track a behavioral health, either a focus or a way to talk about behavioral health, because it was pretty focused on biology and chemistry, which is all important, but also think about some of the softer healthcare skills that are more mental health driven. So, and they were receptive to that comment and asked, what they could do to kind of add to that, either make that a sub track of the path or its own kind of specialized path. So I think that's where the